Another day, another new symptom, another new possible diagnosis. I had pretty bad fluid retention in my legs, and we're talking about a good 10 to 15 pounds of water weight. So I ended up at the doctor and got medication, and it's starting to get better, which is wonderful because when it was bad, I mean, it was pretty bad. My lower legs and my feet swelled up, and my ankles disappeared. I basically had cankles going on. It was very uncomfortable, painful, difficult to walk on. So, yeah, I'm glad that that's taken care of. But I did see a new doctor for this, which was great. I really like him. I'm hoping he's going to be my new GP. He's, he listened. He really, paid attention. Was just very understanding, and I really like him. Um, he actually wants to do some different tests that nobody else really suggested, which was great. I mean, the MRI, of course, which I've been waiting on forever, which is a whole different issue with the insurance company that I'm gonna bitch about that at length in a different log. But after the MRI, depending on what they find, if they find something that explains everything, of course, they probably won't be following up with any other tests if they get their answer from that. But if the MRI doesn't really give conclusive evidence of a diagnosis, this new doctor wants me to get a muscle biopsy and a lumbar puncture, which neither one's exciting, but if they need to be done, they need to be done. I want answers. Even if it means dealing with needles, which is kind of very difficult for me. I have major issues with needles. I don't even like to look at them. When I worked direct care, and I had diabetics, I could poke them and get their blood sugar. But whenever the nurse came with the insulin shot, I had to look away or leave the room because I just couldn't handle that part. Which is one of the reasons I never pursued my nursing license. Because, I mean, what good is a nurse who can't give injections because she's scared of a needle? Um, but if they need to do an LP to get some answers, I will suck it up and just deal with it. The biopsy kind of disturbs me. Just the idea of them going in and cutting off a chunk of my muscle and then running away with it kind of disturbs me. But will do if need to be done. So the diagnosis might change because we were thinking. I mean, it's changed so many times. Originally, it was fibromyalgia and a vertigo disorder, and then after that, lupus and dystonia. And now they're thinking possibly connective connective tissue disease, which basically, the tendons, anything that holds your bones and holds the whole structure together. So that would explain a lot of my joint pain, since the X-ray they did X-ray on my knee and it didn't show any arthritis. So connective tissue disease would explain the joint pain that I'm having, even though I don't technically have arthritis. So that would explain a lot, and it's entirely possible. Um, the other one that they're thinking is multiple sclerosis, which is a little frightening, just because it can be very debilitating. Basically, that's the one where I can't talk. Scars develop different areas. It can develop, on your spine and in your brain, and just cause issues in motor function and brain function, and pretty much anything else. It can affect your ability to speak and swallow, which I have been having those issues off and on. So that would explain that. And it can be very debilitating and painful. So I'm not looking forward to that. But if that's the answer, then I want it. I want the answer. And then hopefully get on treatment. And MS is an autoimmune disorder. So, and we were thinking, I mean, we were pretty certain, we've always been pretty certain that there is an autoimmune component to whatever is going on, just based on the different symptoms I'm having. Because pretty much, you know, when you have joint pain and skin issues and weird skin reactions to like sunlight and things like that, you're generally looking at something autoimmune, something where your immune system is just gone berserk and is attacking itself. So, MS would not, even though it's a different diagnosis, it still kind of runs along the same lines of what we expected with lupus. It just causes different things and can be more debilitating in terms of motor function. Lupus generally doesn't affect your ability to walk and things like that, which is one of the issues I'm having. So MS would explain a lot. So the diagnosis is back up in the air. We're just waiting on a couple of those tests, which is the insurance, which I'm actually going to go ahead and make another one and bitch about them right now because it is absolutely insane. So that's what I'm gonna do. Like I said, a new possible diagnosis that's a little scarier than what we were thinking. However, I'm feeling pretty good today. The fluid retention has mostly dissipated, so I'm feeling better in that respect. So, one day at a time, and today feels like it's going to be a pretty good day.